Hello there, this is Dr. Alugo from St. John Cap, where I empower youth mental health by providing youth mental health education to parents, teachers, and caregivers. Remember, St. John Cap is on Instagram, on Facebook, on YouTube, and also on the Walking on Eggshells with Dr. Tolu podcast. Today, we're going to be discussing young athletes, youth athletes, and their mental health. And I have a very special guest with me, Dr. Sarah Pospos. I'm just going to read her bio and then get her to introduce herself. Thank you for joining me today.
Thank you for having me, Doc.
So, Dr. Sarah Pospos is a perinatal and sports psychiatrist and a former student athlete and also a TEDx speaker. She completed her psychiatry residency as a chief resident at UCLA Kern and has published extensively on burnout and depression at UCLA, UC San Diego, and UC Santa Barbara. She's devoted to helping others feel their best again by incorporating exercise, nutrition, sleep, stress, and time management, especially as a psychiatrist herself and a mom of two under two. Wow. And using other sustainable lifestyle changes. She serves patients in the California area by telehealth. And for non California residents, including those of us here in Canada, she has additional free resources at www.lifestyletelepsychiatry.com. I will put that later on. I'll show that on the screen. So don't be panicking about it just yet. Thank you so much, Dr. Postpost, for joining me. I really appreciate this. Thanks for joining us today.
Thank you so much for having me, Dr. Lugo.
So I'm going to
Such a
get you to
pleasure.
just tell us a bit about yourself. I know I've read your bio, but I wanted you to introduce yourself in your own words.
Yes, absolutely. So, hi everyone. I'm Dr. Sarah Pospos. As Dr. Lugo mentioned, I'm a sports psychiatrist as well as perinatal psychiatrist. So, a little backstory, if I may, for that is because I'm right now a mom of two under two, so a new mom. I became curious because during the stage of life, I noticed that a lot of moms are experiencing difficult transition, burnout, perhaps feeling overwhelmed, learning about so many things at once regarding the baby and whatnot. So I thought, why not try to help moms and combine the two together in terms of my psychiatry practices. Similar to sports psychiatrists, I used to play sports back in the day, really back in the day. So similarly, I thought, why not put the two and two together, combine my passion into psychiatry and become a sports psychiatrist essentially. And as Dr. Lugo mentioned, I'm based in California and I see patients virtually through my telepsychiatry practice as well at Lifestyle Telepsychiatry.
Wow, you are really busy with two kids under two and all of that put together. I think you've got so much on your plate. I don't know how you do it all. So I wanted you to kind of maybe take us through your experience as a student athlete with in terms of exposure to mental health as a student athlete. And then your role as a sports psychiatrist, what have you seen in terms of athletes and their mental health?
Yes, great question. And I just want to preface as well that this is just for educational purposes and not medical advice.
Oh, yeah.
So, in terms of what I've seen as a sports psychiatrist, so in athletes, common problems, if I may put it that way, is somewhat similar to others and non-athletes, meaning there's a lot of depression, there's a lot of anxiety, there's a lot of burnout, insomnia issues, and whatnot. However, sometimes these issues could be very specific. So, for example, choking, sports performance anxiety, um, burnout specifically related to their particular sports could also arise. And because of that, I think it's very important to, whenever you can, to get help or get connected with sports psychiatrists because one, the unique issues might be different in terms of diagnosis or management. Maybe not 100% different, but there is subtleties in that. And two, most sports psychiatrists, if I may generalize it, used to be student athletes as well. There's a lot of ex student athletes or ex athletes who become sports psychiatrists. So that way, they can perhaps understand a little better the nuances of the sports or of an athletes of what's going on in this world as well. Three, if you happen to need medications, there are subtle nuances when selecting medications. For example, some medications might cause certain side effects, weight gain, sedation, um, you know, dehydration, and things like that, that might be subtly different in athletes versus non-athletes. Or on the flip side of things, certain medications might be prohibited in competition or throughout the years in certain sports. So those nuances could really help when when getting connected with sports psychiatrists as well.
Okay, wow. I mean, thank you for really going broad that way. I just still had a couple of, questions. You already touched on the common mental health challenges that we see in athletes. You mentioned performance anxiety, you mentioned depression, you mentioned burnout. Are some commoner than others?
Uh,
Are some of the mental health disorders commoner in athletes than others?
I see what you mean. In terms of athletes versus non-athletes.
Yes.
So in general, most of them are same, meaning not higher in athletes, not lower in athletes, perhaps almost equivalent, uh, except for certain conditions. For example, eating disorders in particular may be higher. Some studies suggest that it might be higher in athletes versus general population. With regards to depression, anxiety, for example, it's more or less equivalent. Now, having said that, certain sports, there are studies that shows that certain sports could have a higher risk of, for example, depression versus other sports. But in terms of athletes versus non-athletes, in general, it tends to be on the equivalent side.
Are there particular strategies that athletes can use to manage their emotional health?
That is a very great question. So, in I don't think it's unique to athletes in particular, but several evidence-based strategies could be very helpful in athletes. For example, number one is mindfulness, right? Mindfulness meditation. So, just trying to be mindful, trying to be present in the moment. It could not only help their mental health, so in terms of mood, awareness, anxiety level, energy level, help with sleep, and things like that. But also on the athletic performance side of things, it might help with being more present in the moment, right? In terms of concentration and just performance as well in general. The second thing that is, again, not unique to athletes, but could be particularly helpful is visualization. So, for example, especially for someone who is who tend to have sports performance anxiety or kind of anticipation anxiety, it could be helpful to visualize your task, right? So, particularly visualize, for example, if you're a gymnast, visualize how you're going to perform in a certain competition, your routine, visualize it from the start, visualize things that might go wrong, visualize the crowd, things that might makes you anxious or nervous and things like that, and then troubleshoot in your mind and just do it over and over again. So this visualization can help with the cognitive and motor performance, and also on the mental health side of things, help lessen that anxiety, anticipation anxiety, uh, improve awareness, and things of the likes. Number three, again, not unique to athletes, but very helpful in athletic as well, is breathing. So deep breathing, intentional breathing, breathing with your diaphragm. I like to count also when I'm doing breathing. So for me, I like to count six while I'm inhaling, count to six while I'm pausing, and then count to six while I'm exhaling, and do it a couple of times. So what it does essentially is switching our nervous system focus from the sympathetic to parasympathetic, right? And with that, it helps with a couple of things, including lowering anxiety level, lowering our heart rate, respiration rate, tension, muscle tension, and so forth. So it could help in the moment, in the middle of a game, for example, in the middle of a competition, um, on the big day, or you can also do it outside of that context. For example, when you're having trouble sleeping, when you're just trying to relax, first thing in the morning, and things like that as well.
Okay, wow. So mindfulness, visualization, breathing exercises. I like those tips. Do you find that a lot of athletes, particularly who are playing at a high level, really delay help seeking? Are there barriers to people seeking help for their mental health?
Great question. So, stigma is unfortunately real, right? Including mental health stigma. Perhaps there are stigma that athletes has to be strong all the time. Mentally as well, right? Perhaps if they admit to being depressed, it's a sign of quote unquote weakness. So the stigma is always there. But I would say that recently, more and more athletes, including pro athletes, are coming forward with their own mental health struggles. So we're seeing, across the board from the NFL, the NBAs, and so forth. So that hopefully would continue to help with lessen the stigma a little bit more, and we can see that athletes and in general the public can seek help, seek much needed help sooner, so that they don't have to struggle alone and be in much of a distress alone, suffer alone essentially.
Yeah. And so apart from stigma, do you also find that because of the fear of, medication, its impact on performance and particularly testing requirements, that people are afraid to go on medication or to stay on medication? Is that a problem that you see a lot in your practice?
That is, yes, a very good observation. So yes, definitely, Dr. Lugos, some if they can, right, some would like to stay off of medication, or perhaps try to put off introducing medications as much as possible. So I'd say, in terms of psychiatry, for example, in terms of depression or anxiety, if it's on the milder side of things, right, milder symptoms, we could go eh, according to their preference. Of course, we can try either just therapy, either just medications, or a combination of both in the case of milder symptoms. But also, uh, in those cases, I would emphasize or highlight if they already tried other means. For example, if they already tried therapy for a year, or if they already tried lifestyle tweaks, for a year and things are still not looking up, then perhaps it's a good time to just try to see if medication might be helpful in that sense. So, to answer your question, yes, I do see those trends at times as well.
So I know obviously, like we said at the beginning, this is not medical advice. We're not your physicians, but I do see a lot of young people, particularly who are prescribed antidepressants, and they're afraid to stay on antidepressant because they're thinking it may affect like testing prior to competitions. So I'm just wondering, is that a myth? Are those one of the medications that we should be concerned about that may affect test results, for example, before competitions?
Yeah, great question. So it depends on the specific medications, right? Because
Mm.
each medications has their own side effects, potential side effects.
Yeah.
So, for example, a beta blocker. It's not, we don't use it for usually depression, but we might use it for some sort of performance anxiety. In terms of affecting performance, because it helps with fine movement, right? It's sometimes also used for tremor. So it might affect fine movement performance in a way that it is actually considered prohibited in certain sports that emphasize that fine movement component. So, for example, archery, shooting, things like that. So that's a long way winded way to say that it depends on each medication's potential side effects, but just be mindful of those side effects, potential side effects in relation to your particular sports and situation, and regulation would be really helpful.
Yeah, so it's sounding like you really need to get a physician who knows what they're doing, who is able to really give you advice on, the medication, the side effects, the metabolites, and the rules for whatever sport you're participating in, is what I'm hearing you say.
Yes,
So,
absolutely.
I mean, I see sometimes you hear about, you hear parents just being so distressed because maybe their child is playing sports competitively but gets cut from a team, or they're not getting enough playtime, and then the child is really down in themselves and just really struggling. What kind of tips would you have for parents in that kind of a situation where they're trying to support a youth athlete who may or may not have mental health challenges?
That is another great question. So, it could be very difficult, uh, but I believe, growth mindset is very important, especially during tough times, right? Including the situations perhaps that you mentioned earlier. Meaning, uh, it might be helpful to support the athletes, of course, support the youth, and emphasize the fact that their efforts in this case, right, is more than the quote unquote outcomes, so to speak. So perhaps emphasizing on how far they've become, how consistent they've been with the practice, with all the works that they put in, how they never give up, how they work really hard to get to their goal versus quote unquote the outcome of being cut on from the team, for example. So that way, hopefully, it'll help also with the athlete's identity, the athlete's mindset, because one of the things that I'm seeing in athletes and especially young athletes too is it's very important for them to have self identity outside their sports, outside their identity as an athlete. That way they could be more well rounded, and in times of challenges or trouble they have other quote unquote things to lean back to, other things that they that could build up their identity, their self-esteem, and doesn't fall as hard, so to speak.
Right. So as parents, you should be encouraging them to have other interests apart from this particular sport that they're playing, in competitively. Are there
Mhm.
any tips for like coaches? Are there any tips for coaches for handling, this kind of scenarios with an athlete who is struggling with their mental health, perhaps?
For athletes who the coaches might suspect having mental
Hmm.
health struggles.
Yeah.
Yes, so well, number one, I would say try to continue to be supportive. Number two, to encourage them if you can to seek help, so seek professional help. Usually, the red quote unquote red flags that we're looking for in terms of when to seek professional helps are as follows. Number one, if the symptoms, whether it's anxiety, depression, burnout, things like this, have created internal distress, severe distress in them. So if you've seen those kind of signs, those kind of observation, or number two, if the symptoms have interfered, have interrupted or impaired their day-to-day function. So perhaps their grades, their relationships with family, with loved ones, with teachers, coaches, and stuff like that. Perhaps their work, if they're also working on the side, their sports performance. So if you see either one of these red flags, then it's time to seek professional help. And your role as a coach could be to encourage them to go that direction as
Great.
well.
Oh, thank you so much. Those are great tips. So I'm wondering, so where can we find you? You mentioned your telepsychiatry.com. Is that where people can go to for free resources, or where is the best place to find more information?
Yes, so you can visit my website at lifestyletelepsychiatry.com. You can also find me on Instagram with the same handle, lifestyletelepsychiatry.com. And, I actually also am very passionate about the topic perfectionism, which, as you probably can tell, athletes have a lot of issues on this, right? So if that's the case, please feel free to check out my TEDx talk as well. You can just search Sarah Pospos on YouTube. And the title for that is Why Better is the Solution to Perfectionism.
Wow. I'm looking. I'm going to go check that out as soon as I get off of this interview now. Well, it's been great having you. Thank you so much for joining us. So before I let you go, do you have any last word of advice for any young athletes who may be having challenges with their emotional health?
Yes. So, if for anyone listening, if you're in the middle of feeling depressed, or feeling very anxious all the time, 24/7, perhaps having that dread of waiting of the other shoe to drop all of the time, which could be very exhausting, feeling very burnt out. It could feel at times, especially if you're in the middle of all this, that there's no way out, that there's no light at the end of the tunnel, that you have no options. But I just want to assure you that help is just one click away, one one email away, and you don't have to suffer alone. Please seek help, and then don't lose hope. So if you're in California, then you can contact me through my website, lifestyletelepsychiatry.com. If you're outside California, please get in touch with your local psychiatrist. If you're in the area, please get in touch with Dr. Alugo as well, and then we can help you from there.
Great. Thank you so, so much. Thank you all for joining us today. It's been great, doing this again. And I want to say a big thank you to you, Dr. Pospos, for this great session. And we have learned so much, and I'm sure my audience would really benefit a lot from your expertise and all the information that you've shared. Thanks a million.
Thank you so much, Dr. Lugo. Thanks for having me, and have a good rest of your day. Thank you,
Thank
everyone.
you. Thank you, everybody.